Hey Cam followers, welcome to another one of our lives. Tonight we are joined by one of Cam's very own, Kirsty Cavill, who is a vet nurse, a myotherapist, and she's one of our Cam experts. So we're really happy for her to be joining us tonight.
Evening. Hello everyone.
Do you mind telling everyone a bit about yourself, Kirsty?
No, so people that follow Cam might see me from time to time on my name pop up, sort of posting the blogs and things for Cam. But I've been involved with the team for it's well over 3 years now, so for quite a long time, and I've done sort of different things, but absolutely passionate about canine arthritis, hence volunteering for it. But I've been a nurse for 30 years this year, which is a little bit scary. It seems like a very long time, but I've seen an awful lot within that time that's given me probably the experiences to push my career in a way forward that I was really passionate about, which is rehabilitation and the management, particularly of senior pets, because I think when I first went into the profession, it was very underrepresented, that sort of demographic of pets. And they're just totally awesome, senior pets. And I think, you know, we owe it to them to do everything we possibly can, not only throughout their lives, but particularly, you know, towards those stages when they are becoming senior, just to make that quality of life as high as it possibly can be.
Yeah, absolutely. So what did you do first? So you obviously started with nursing, and then you moved into myotherapy. Do you want to talk a little bit?
Yeah, so I'm still a registered veterinary nurse. I'm a head nurse for a telehealth veterinary telehealth company. I still out on the streets practicing with street vets, so a volunteer team lead nurse with them. And I sort of, about 3-4 years ago, I had a senior dog myself. He was about 10 or 11. He was struggling, and I was like, really, I should be able to do more for my own dog. So Hannah was a Garland myotherapist, Hannah Capon, who set up Cam. And I kind of looked at what she was doing and thought, I want to do that too. But it's not easy, and it's a really specialist skill. So it's not, as people say, canine massage, not just you can do a weekend course and set yourself up. The course is about 2 years. I did it slightly quicker, and it was for veterinary professionals, my course, but there's a lot involved, practically going there for weekends, the paperwork, the essay writing, the research, anatomy and physiology. It's so in-depth, but I think that's really reassuring because it needs to be.
Yeah.
We need to know what we're feeling, we need to know what we're seeing, and we need to know how to act on that. So it was Hannah really who inspired me to get into myotherapy, and one of the other Cam nurses, Lindsay, was on the same course as me. So we've got at least 3 my official.
Brilliant. So I think what I'd like to discuss with you is what role nurses can play in normal general practice, in senior clinics and in arthritis management.
So I think it's definitely an area that's increasing in general practice. It's things I'm seeing more and more practices advertising, sort of senior clinics. We've all seen the puppy clinics for years and years and years, and puppy parties.
Yeah.
But now I think we're becoming more aware of the need, and nurses are becoming more specialised. I mean, you know, veterinary nurses, take my hat off to my colleagues, they're highly skilled professionals. They've been through rigorous training, examination. It's not just something you do for a hobby. It really is a career. And I'm seeing more and more nurses specialising into different areas. And thankfully, lots of nurses are specialising in the management of senior, arthritic or physically compromised pets. The majority of those will be dogs and cats. But obviously, you know, we have high percentage of rabbits and things as well that come into clinics, senior rabbits that also need the same sort of help. So I think the nurse's role in the senior clinic pretty much unlimited, in the sense that they often have a little bit more time. They can get a slightly different relationship with the owner and the pet than a vet can do. And that's often just down to logistics and timing. So I would want at least 45 minutes, preferably an hour, for a senior clinic. Now that's just not viable for the majority of vets in general practice to achieve that. Yeah. We need to be realistic. That's not going to happen. But, you know, the nurse is really involved from start to finish of that patient care, developing treatment plans for the patient with their vet. And I think the one thing that I found is really useful is having a named vet and nurse team for a patient. So as much as you possibly can, you're getting that continuity of care, the continuity of treatment, but also you can assess that patient and you're able to determine whether there's been measurable change for the positive or the negative between appointments. And if you've got a named vet that you're going back to and the owner's built that trust with you, you've got that kind of triad of treatment protocol going on where everyone trusts everyone, everyone knows how other people work, but we can effectively assess that patient each time we see it, and we can go back to the vet, or the vet can pop in as well, and they know how that dog or that cat was the last time they saw it. And I think that's so valuable, and it's something that in practice maybe hasn't happened, you know, years and years ago. It was very different, but it is the way that we're moving forwards. And, you know, from a senior clinic, we're looking at everything from, you know, the physical side, but also the medical side. So lots of senior pets have comorbidities running alongside. So, yes, we know they have compromised physical capabilities, but their kidneys, their liver may not be effective. There may be some degree of cognitive dysfunction or syndrome developing, which affects every area of their life as well. And I think if you're running a senior nurse clinic, you need to be mindful of everything and look at the animal as a whole holistically, and not just the area that the owner's necessarily concerned about.
Yeah, I think, you know, the one area as a vet myself, as a GP vet, that I feel that gets neglected in the clinic time that I have is the home management, and actually really reviewing all of the things that are going on with those pets, and having the time to do that is something that I think actually nurses are generally better than vets at getting that information out of owners. I think often with owners, probably not with me because I'm quite relaxed, but with a lot of vets, it's a very formal relationship, and they wouldn't disclose things about where the dog sleeps or the dog's up to, whereas the nurse is often much more approachable. And I think I know the nurses myself often get way more information than I've got on something, and I'll say, "Oh, they never said that to me."
I think it's a different dynamic, isn't it, between a nurse and a patient, and a vet and an owner, and you know, and I think it's, if we all work together, we get the best results. And I think it's trusting your team, whether that's the nurse trusting their vet or the vet trusting their nurses, that they've got the skills and capabilities to run these clinics. And I think those relationships are changing in practice, and they're becoming more widely recognised. And I think, you know, absolutely, this is the way we should be moving forwards. And, you know, I'm really keen on following up with owners. I'll try and get in touch with them ahead of the first clinic. Ideally, I like to go and visit them at home. Now, just for the first visit, if nothing else. Now, obviously, during COVID, that's gone out the window. We can't do that at the moment, but what I can do is get my clients to walk me around their home on video and show me where the dog sleeps, show me how it has to navigate. Does it have to go up steps? Does it use a dog flat? What's the garden like? So that when they bring that information, I've had that emailed ahead of time, and I can assess that already. And I'm starting to build a picture in my mind of what that dog or cat's life might be in their home environment.
Yeah, because it's so you don't get an accurate idea of what's going on. You get a snippet of time when you see that pet, and it doesn't really reflect what you're necessarily, what they're experiencing at home.
No, and often they don't behave the same in clinic either. You know, the owner, you know, has come for a reason. They want to get this done, and they want to get the best outcome for their pet. But the pet often doesn't behave the way they behave at home. So if they're a little bit more anxious or on edge, or they're a little bit hyper, as some animals can be when they come to the vets, they love it so much and they want to see the receptionist for biscuits, and they just want to say hello to everybody. You try and assess their mobility, where the owner says they're dragging their leg or they're lame, and there's no lameness to be seen at all. So, you know, those videos for me are essential. And I also ask every client I see, whether it's through my own business or in practice, for a mobility diary. a written one, but also a video mobility diary, so that I can assess that animal's movement. So I know where it sleeps. I know if it has to go upstairs at night because I've got that, but I also know how it moves around its home or out on a walk, or how it gets in and out the car. And that's all added information for me that's building that picture about that animal.
Yeah, that's great. And you've also got something to compare with, haven't you? So in 6 months' time, you can listen to those same videos again and see what's going on. That's great.
Absolutely, yeah. And I find owners love it. They love to be given things to do with their pets. So, you know, if you ask them to do a slow-mo video of their dog walking, they love doing it, and they love sending it into you, and they want to know what you think. So, you know, how do you think he's moving? You know, I think he's moving a bit better. And it also gives us a reason to check in with each other between appointments, which I think is really important, because, you know, with the best will in the world, an owner doesn't want to bring their pet into practice more than they have to. I don't want a senior or an older animal coming into clinic more than they have to. But if we can check in with each other between appointments, we're building that trust. We're sort of reinforcing our subtle messages we're trying to ask the owners to do between appointments. So, you know, if they send a video and the dog's charging across the field with the ball, I might just send a gentle reminder that maybe that isn't the best thing for their dog at this moment in time, because we know from the studies that the majority of the information we give to owners in clinic is gone within less than an hour when they walk out the door. And that's why we often get phone calls from owners saying, how much Metacam did you say? Or how did I use that syringe? Because they're in a different mode than we are when they come to see us. They've got their pet with them, so they're slightly preoccupied by that. The owner's in a strange environment. It's alien to them as well. And it can be quite stressful for owner and animal in clinic. And I think so many of them forget some of the vital information we're giving them. So another thing I'll do, apart from a text or an email in between visits, I might just give them a quick call and just say, hey, you know, saw you 10 days ago, how are you getting on with the new treatment regime, or how's your dog doing on the meds? It takes a couple of minutes, but I think it really helps to reinforce that bond between vet, nurse, owner and pet.
Yeah, and give them the opportunity to ask those questions that they weren't thinking about. So if we're talking about a practice who hasn't yet got their nurse clinics up and running, how do they start an arthritic clinic or a senior pet clinic?
So I think, first of all, you need a named nurse team or a nurse vet team who are passionate about this area. I think it is something you need to throw yourself into. You do need to be, you know, every nursing clinic is a qualified veterinary nurse. They're all trained to a high level. But we all know that people specialise and people do further training. If senior animals are something you're passionate about, do some more learning on it, do some CPD, find out, you know, about these things, and come on the CAM website, because there's so much information on there for veterinary professionals, for owners. I'm always dipping in. You know, we can't remember everything, and we don't need to, because the resources that have been put up on CAM, most of them are free to access for anybody, owner or vets alike, nurses. Go on there and have a look at some of the protocols we've put in place, some of the sort of ways of approaching a senior pet, and, you know, what we would expect treatment wise for that pet, and how you might go about approaching an owner and doing that. There's so much on the CAM website. But also get in touch with colleagues. Try and find a clinic that's up and running in your area. And I found practices are usually really happy to help you or talk to you or show you. I mean, I think I'm in quite a privileged position. I work with lots of practices with my own business. I only work on referrals, so I need to speak to them regularly, and I'll often pop in, or I might even see their patients in their clinic. So I get a really good idea of what other practices are doing, how they're managing this, you know, and I pick up tips from other people. And I think don't be afraid to ask. I think that's the thing. I mean, the CAM team, we're always bouncing ideas off each other. You know, we have pets, we're pet owners, and when our pets aren't right or they're not well, we're usually quite useless. And in fact, you forget everything you've ever known and you ask someone else. So don't be afraid to ask. I think that's the first thing. And don't put yourself under undue pressure. Don't try and do everything at once. Take it a step at a time. Find a client that you think would be suitable, talk to that client and invite them in to come and talk to you first of all. And I think naturally the progression of the clinics will develop as you build in confidence. You don't really need anything particular. You know, you are assessing that animal as a whole. So you're going to want some way of recording that. Again, on the CAM site, there's lots of helpful literature to help, you know, to give to owners. You've got your good day, bad day sheet, which is fantastic. You can print that off. You can hand it to an owner. The owner goes away happy. They've got something to do. You've tasked the owner with something to do and they'll bring that back to you. That's your first step in that clinic. You've started, you've made that first link and you're on your way. So I think ask, don't be afraid to ask for help, you know, chat with other team members, but get a team around you in the practice that are as passionate about it as you are, that will support you and you can support them.
That's brilliant advice. Thank you, Kirsty. And then from an owner perspective, could you talk about the difference between visiting the vet and going to a nurse senior clinic?
Yeah, so I think it's completely different. And as an owner, I've obviously, you know, been party to both and been on both sides of the table. So I think when you visit a vet, vets in the UK have time restrictions for clinics on the whole.
Yeah.
And that's just the way it has to be. It's exactly the same as your GP. I think a nurse clinic is much more informal. It's less time pressured, but it is just as professional. And I think, you know, I will quite happily sit on the floor with the dog for the majority of the appointment if that's what I need to do to make the owner and the dog comfortable. Now, obviously, COVID has got in the way with a lot of things at the moment. And we've got a lot of senior dogs that maybe at the moment have gone several months without the intervention they may need.
Yes.
So dogs that have regular hydro, physio, acupuncture, myotherapy, physiotherapy, that's all been compromised. So I'm finding that there's a few patients out there that I'm seeing that I've had to go back a few steps with at the moment and take that time out to explain to the owner, unfortunately, you know, they've missed 12 weeks of treatment. That will have some effect and we need to just step back and be realistic about the goals we can achieve. But let's sit down and talk about that and find the best way forward. And I always try, and it's I think of one of the biggest things you can do is get the owner to trust you with their pet.
Yeah.
And spending that time with the owner, explaining to them why you're asking them to do things, explaining to them why we need that blood test because we haven't had one for 4 or 6 months and the dog's on medication, just letting them know why we're doing things. We're not just doing it for the sake of doing it. There's a reason behind everything in the veterinary profession we do. There's certain cascades of treatment that we follow, that we're obliged to follow. And I think really the difference is the nurse can come the other side of the table with the owner, if you like.
Yeah.
Sit down, talk to them, give them that empathetic ear that they might need. And we're less time pressured. And I think that's the biggest difference, is that we can offer the owner in these specialized clinics the time to listen. Because, you know, from it, and I don't only treat senior dogs, I do rehab on young dogs, post-injury, anything like that. But the one thing I find is the minute there's something wrong with the dog or the cat, the owner's in a state of anticipation of what might come next. And obviously, as the dog gets or the cat gets older, you've got that, with a diagnosis, you've got that anticipatory grief. And that doesn't necessarily just relate to end of life. It relates to the fact that maybe something's changed in their animal's life that they have no control over. Yeah. And life has changed and we need to adapt to that. And I think what's one of the most important things, as well as supporting the patient, is to be able to support the owner. Let them feel valued and let them feel that you're listening to them and you will act on what they're saying. It's not just going in one ear and out the other and on to the next patient. In a specialized clinic, you're investing in that owner and their pet for the time that they're with you, but you're going to follow up with them afterwards. So I think I try to make them quite relaxed. I try to make them less formal. COVID aside, as I said, I will sit on the floor with the owner, with the pet, and we will just sometimes just sit and talk.
Yeah, it's so important to be able to give that time. I think you make a really, really important point about anticipatory grief, which is something that I know we're so passionate about in CAM, but actually across the veterinary field is not that well known about or understood anyway. We probably have all seen it and experienced it, but maybe not had the words to label it. But then we've all been through it in some way or shape or form in our lives with various pets or
absolutely.
And it's such a difficult thing to cope with.
And I think veterinary professionals as well experience it for their patients. It isn't just, you know, the owner-pet relationship. It's a two-way thing. And I think the more we talk about it and recognize it, the more we can help each other and certainly help owners through what could be several years of feeling slightly on edge, slightly uneasy, slightly vulnerable, that their pet isn't what they used to be. And I think, you know, you have a dog or a cat with a diagnosis of arthritis under the age of 2, and the owner's feeling, you know, stressed about that. That's a very long time to be feeling that way without decompressing and sharing that with someone. And I think as a profession, we are getting more aware of it. CAM are super aware of it. And I think it's because so many of the CAM team have been through it themselves. We've had pets from puppies right the way through to 15-year-olds. We've lived it. And I think when you've lived it, you can understand it and you can empathize better.
Yeah, definitely. And I think it's very, it's nice to be able to show the human side of veterinary, because we're often, I think you're right, as vets, we're very rushed. So we have to diagnose, take a full history, get the treatment plan all sorted within 15 minutes. Okay, I'm really sorry that your dog's got this. Here you go, here's some meds. Come back and see me in 3 weeks. Let me know how you're getting on. Well, actually, there's a whole lot of emotion that goes along with that. And
absolutely.
I mean, I know myself, even with my own pets, if I have to take them. So I'll tell you a very quick story, but very recently, my dog's been having vomiting and diarrhea on and off. And I got really panicked about it, even though I know he gets sticky tummy sometimes. And I thought, right, and I've been furloughed, so I wasn't at work. So I thought, right, I'll book him into work and I'll get them to do bloods and maybe a scan if he needs it. And then on the day, I got myself so worked up, I cancelled it because I didn't want him to go in because I was too worried about it. And not that I didn't trust them, because I know they're amazing, but he's my baby. I'm a vet, and I should be, you know, I should be more logical about it. But you just can't with your own.
We're the worst. We are the worst, absolutely. And I think it's refreshing for owners to understand that actually when our pets have to go in to have anything done, we're generally in pieces. And it's not because we know the worst case outcomes or anything like that. Is that we don't want to hand our pet over to anybody else. And that's a very natural feeling. And, you know, I think because we've experienced that and we understand that, we can understand how that, you know, the face of that owner when they come in with their pet for a GA or something, or to be admitted, you know, actually that range of emotion that they're going through. And I don't think it matters what age the pet is, what sort of medical condition the pet's got. It's the fact that you're being separated from your pet, and that's really difficult.
Yeah, well, even like children, you're so involved in their life. You're constantly their caregiver. It's a huge thing. When you add in a condition like arthritis, where you really are their caregiver, they can't cope without you. It adds another level of stress to the whole situation. So I think you're absolutely right. These having amazing nurse clinics like this is such a valuable thing to have in a practice. And
can I just jump in at that point and say, actually, I've changed my mindset quite recently on senior clinics, and actually I now start them at puppyhood. Sounds crazy, but actually all the puppy parties that go on, all of those things are amazing for socialization, for everything. But I thought to myself, why on earth are we not educating owners when they've got young puppies whose, you know, joints haven't, you know, formed fully, the growth plates are still sort of, you know, forming. We can really get in at that point and educate the owners about the life care of their pet, and look for not look towards when they're old, but say to them, look, you know, the ball launcher in the park, not a great idea. You know, when your puppy starts to go out and starts to exercise, how about thinking about doing this, this and this? Because, you know, there's less trauma on the joints, there's less risk of injury. And actually that's a really good thing to teach your dog when they're young. You know, get them to use a ramp as a puppy. you know, so that when they get to the stage where they might need a ramp, they're used to using it, and it's no big problem at all. So for me, in the last year, 18 months, that's been the biggest, you know, shift in my mindset, is actually the senior clinics in my mind are starting when they come in as puppies, and we're just drip feeding some of that stuff in. And it's been really interesting. It's been really popular. And, you know, hopefully if we can't stop arthritis, and we certainly can't cure it, but if we can stop some of those injuries that might lead to arthritic changes by just talking to owners when they get their puppies, that's got to be a worthwhile thing.
That's a fantastic idea. And you say it's been quite popular. How do you sort of advertise them? What do you label them as a senior clinic, or how do you tend to...
Yeah, so no, and I've been talking to a lot of my colleagues about it as well. So most of the patients that I see through my business are on recommendation or referral from vets. And, you know, I find it really interesting because I've had people come to me and say, oh, I hear you're doing this for this dog. I've got a young dog. Can you come and have a look at it? I'm like, well, okay, yeah, that's fine. Is there a problem? No, but I've seen the videos, and I really want to know, you know, about this, and this. And it might be sort of, you know, walking on different surfaces. It might be a certain harness. It might be not being a weekend warrior and, you know, having short walks during the week and then going on a 20-mile hike at the weekend. It doesn't matter if it's a young dog, it's going to cause muscular and myofascial discomfort. So that led me to start to think about, and we'd actually just put puppy clinics and puppy awareness days, started to advertise them when we went into lockdown. So that's something that's gonna be picked up again, because obviously clinics are a little bit tricky at the moment. You know, I don't want to have that sort of atmosphere where I've got a screen down in front of me or the owner's behind a line. Totally needed at the moment. You know, we're masked up, we're gloved up, whatever. We need to do that at the moment, and it's, you know, that may be like that for a little while. But as soon as we come out of those restrictions and, you know, life is a little bit back to a normal pattern, then that's something that I'm going to really try and initiate in my area. I've got amazing practices in my area with the most incredible nurses. I'm lucky to work with some of them when I go out with Street Vet. So I'm going to see if I can gauge the interest with them and say, look, when you're doing this, how about just drip feeding this in, and let's just start and build up from there. But it's something that I think, why didn't I think of that before?
Yeah, I mean, it seems so
you don't
say it.
Puppy parties are amazing, but we can be educating owners about how not to injure those joints and muscles and fascia at a young age, so that we get less injuries coming in and then less compensatory issues to deal with later on.
Yeah, that's fantastic. I think that's such a good idea. So what I would like to delve into, unless you want to talk anything more about the nurse clinics, but I'd just like to talk a little bit about what you do as a myotherapist. What is myotherapy and what does it involve?
So in its simplest form, myotherapy is muscle therapy. And I have had to explain that to a lot of vets that say to me, what is it?
Well,
what is it?
The legs are made up of joints, isn't it? There's not those muscles. They're not important, are they?
No, they're not. No, things like that. So yeah, basically, myotherapy is working with an animal, and we look at the myofascial system of the dog or the cat or rabbit, whatever. Lots of horses have myotherapy as well. The muscles and the fascia are separate sort of in the body, but they're so interconnected. And years ago, the fascia in surgery, particularly in the human model, would be stripped out and almost chucked away at the end of the surgery. It wasn't deemed to be important. It's a connective tissue. It should be quite gelatinous, and it surrounds every organ in the body.
Yeah.
But if you had like an abdominal surgery, they'd often move that bit apart and not necessarily put it back properly at the end of surgery because it wasn't deemed to be of any importance. We now know it has a nerve supply, so it has a huge importance when we're talking about pain. And as a myotherapist, we look at an animal as a whole. So we don't just look at a dog that comes in with a lame back leg and treat the back leg. We look at everything to do with that animal. So the first thing I do is talk to the owner at length. I give them a questionnaire about their dog. Can your dog shake? Can it roll? Has your dog ever had a trauma in its life, even if it's 10 years before? That's relevant to what we might be seeing now. And we need to know about the muscular system of the patient we're looking at. Obviously, they're subtly different between species, but muscles are muscles. We know how they work. We know they have a blood supply. We know they have a nerve supply. We know what their function is. We know where they insert, where the origin is, and how we want them to move. But as a myotherapist, we often see that they don't move properly. And what I say to owners is, what have you noticed in your dog? What is different? And they'll say, wow, I think he's lame on his right foreleg, or he stumbles a bit. And I might look at the dog and say, well, actually, he's lame on the left hind, but you're seeing the compensatory issues on the right fore, or vice versa. Dogs are very good at compensating on the diagonal or from front to back. They'll shift their weight away from the area of the problem to hide it. In the wild, it's not in their interest to show a weakness. And even domestic dogs will shift that weight away from the area that's a bit sore. And, that's something we look at. So we're looking at weight loading, we're looking at gait, we're looking at neck, we're looking at how does the dog eat? Can it chew its food? Or actually are the muscles in its neck so sore that it can't chew its food properly? So we're trying to look at the dog as a whole. And even if it's referred to me for one little area that's been identified, a disc or something, I'm still going to look at that animal from top to bottom. Yeah. And the fascia is fascinating if it's something that that you're interested in. And fascia should be gelatinous in its nature. The muscles should glide smoothly between the layers of fascia. And if the fascia is compromised by illness, by repetitive strain injuries, by lack of movement, and it's drying out, and it becomes a bit like a matrix that's solid, a bit, I call it my concrete dogs. So you can see them walking towards you. The muscles want to move, but they physically can't move within the space that they've got, because the fascia has become rigid and unresponsive. So as a myotherapist, we're working on the muscles, but we're also working on the fascia, which is around the whole body. And myotherapy will affect everything from the urinary system, the reproductive system, the nervous system, the cardiovascular, respiratory. It affects everything in that dog, which is why it can be so effective as a treatment in dogs with compromised mobility, following surgery, following injury. And I found, because you're an acupuncturist, a veterinary acupuncturist, aren't you? Yeah. And I found that myotherapy and acupuncture used in rotation can achieve some amazing results.
Yeah.
Absolutely amazing. And, so my work as a myotherapist, I can't say I just put my hands on a dog and give it a massage, because I don't. People that have qualified as myotherapists or as clinical canine therapists, massage therapists, have gone through quite extensive training. They really understand the dog, the anatomy, the physiology. They understand what they're seeing, and they understand what they're feeling in your dog. So I will assess a dog, I will give a treatment to a dog, but that dog and the owner will get homework, and the homework is between visits or treatments to do with their dog, and it's usually a targeted exercise plan, and it will always have a lifestyle adaptation suggestion sheet in there as well, because there's absolutely no point in making a dog more comfortable or releasing areas of muscular compensation or tension for the dog then to go down the park and chase the ball for 30-40 minutes in a repetitive nature. That's not going to achieve anything. And it's kind of like just putting dogs on non-steroidals to take the pain away, but not changing the reason for the pain in the first place.
Yeah, I totally agree. I think it's really important that people understand that doing a massage at home is not the same as having a myotherapist come and treat your dog. You're gonna I've seen dogs where they've gone in before, and maybe they've been too painful for me to stick needles in. They're too needle sensitive, and I can't treat them. So I'll have a professional massage them, and the dog is like a different dog at the end of that. And they're literally within that half an hour, 45 minutes, whatever it might be, a different dog from start to finish. So
and I think we know what we feel like when we've got a sore, stiff back, or we've been sat in a silly position and, we're really stiff and sore. We get a bit grumpy, we hurt, and it's the same for animals. And I think, I sometimes will cut a session short if I go to see a patient and they're either too painful for me to touch them and get hands on, then I'm going to refer them straight back to the vet to get sometimes pain control. So if they're allergenic, which means when we touch them, the whole body over responds, I'm not going to treat that pet at that moment in time. I'm going to give them lifestyle, possibly some very subtle exercises, but I'm going to say, we need to discuss with the vet how we can get your dog more comfortable before I can even treat, your dog. So I think it's that triad and that trust of between the professionals to work together. And I think, the concept of interprofessionals all working together as a team and not being afraid to say, actually, at the moment, this case isn't for me. I'm going to ask you to see such and such, but come back to me, later in time. We can't be afraid of losing patients. And I think when we work in that way with other veterinary professionals and we refer patients back and forth, we actually keep our patients for longer because they see results and they're happier. And I think, I see it as a toolbox. Each animal has their own toolbox that they need for a treatment plan, an individual treatment plan. And if sometimes that toolbox, you need to say, okay, I need you to go back. We need to look at the meds. They need to be changed. That's not for me as a nurse or a myotherapist. That's for your vet. I will talk to your vet. Let's get that under control, and then let's come back to me and we'll start again. And I think it's having that flexibility to bounce back off people and not be afraid to say, actually, I've seen your dog 3 times. I would have expected a measurable change by now. I haven't got that, and I want to know why. So I'm going to ask you to go back to your vet for more diagnostic tests or another discussion. Come back to me, let me know, and come back to me afterwards. But for some reason, what I'm doing hasn't affected the change I would expect. So there may be something else going on.
I think it's so important, isn't it? And not as a therapist, not to be too proud to say, actually, this hasn't worked. And I'm saying to you, if I've seen no changes in 3 treatments, I'll say, I'm not saying the acupuncture is never going to be a possibility, but it's not working right now. So let's try something else. And I work very closely with other therapists. I'm lucky because I'm a vet as well, so I get to play with drugs a little bit. But that I still have to work with my GP vets that refer to me, and I think it's about being part of the team, isn't it? And not.
And I think it's
share.
No, and I think that's so important. And I will write treatment plans, but I'll also send reports back to the vets that have referred. So everyone's in the loop. So they'll know what I've done. They'll know what I've found, even down to specific muscles or points of muscles that are painful or compromised or have a myofascial trigger point, which is a really tight compromised point that needs a lot of work. I will let them know all of that. So if the client goes back to them for a routine appointment or something in between times, the vet's fully up to speed of what's been happening with that owner and that dog. And I just think that's the way as a profession we need to be moving towards and keep going with. It has to be, I think, the way forward.
Yeah, I totally agree on that. You just mentioned a trigger point. I wondered if you could just quickly explain that, because we do say that a lot as therapists and we don't always.
We do, yeah. And I think trigger points can sometimes mean different things to different people. So for me, a trigger point, if I'm palpating an animal, feeling them, gently working down, I'll generally go from head downwards. But I'll have a good feel. If I'm gently manipulating or feeling an area and I get an involuntary response, so I might get a muscular quiver. You might sometimes see a leg shoot out, or the dog suddenly turns around and looks at you. They're the visual clues for a trigger point. That area is uncomfortable, it's painful, or there's a sensation there that isn't normal. Yeah. Now, when I'm palpating and actually feeling it, it can feel like a really hard type of knot. It can feel like something's compromised down in the tissue layers. And it may not be at the surface, it may be down more than one layer of muscle. And it's something that to me is a really good indicator of things that are happening within that dog, because you don't have trigger points in a dog that is completely musculoskeletally healthy. Yeah. There is something that's causing that, and it may not be at the site of the trigger point. And then if it isn't obviously there, we need to go feeling and finding where the area of compromise is. But for an owner, they might notice that when they touch their dog, they get ripples down the back, or the dog suddenly moves away from them, or they don't like being groomed in that area anymore. And that will often be a subtle clue that there's something going on under those layers at the top. And for me, it's those involuntary movements that you touch it in a certain way and the dog or cat has no control over that response at all. And that's when we might get that sort of, the leg flicks out or the toe moves or something. But it's an area of compromised tissue.
Yeah. So I think most people will know, because in the back of most people's necks, shoulders, you'll find that horrible knot that likes to cause pain. And imagining that's just in one area, and luckily it only really affects when I'm really moving my head. But imagine being a dog and having that in the middle of your back and being four-legged and your back needs to move every time you move. It's
exactly
debilitating for them.
It is, and it really does, and it really affects their quality of life. And to me, the presence of a trigger point is just the start of things. I want to know where it's coming from and why it's developed where it has. And that's something that you won't necessarily determine on a first visit. I try and see all my patients at home, if possible. Obviously, again, at the moment, that's not how we're working. I might see them outside in the garden. I might see them in clinic. It's a little bit different at the moment, but hopefully we'll get back to some normality soon. But I want to work that animal. I want to find that trigger point. Then I want that animal up and mobilizing so I can see how they're moving. Is there any compromise in their gait? Actually, it's in a lower back or the lumbosacral region. And when they're weight loading, they're only putting 10% of the weight through one of the hind legs. So we know that trigger point is affecting the weight loading and vice versa. And often with these musculoskeletal problems, they're all so interrelated to each other that actually if the dog's sore at the back end, I can almost guarantee before I even touch it that the neck will be shortened and compromised and vice versa. And I have owners that say to me, I think my dog's got longer after a treatment. My dog looks longer or taller. And it's literally, we've gone from this to this, because we've released those muscles that allow that flexibility and the lateral flexion in the neck and the animal to move. And that's just releasing the muscles. And that might just be on the first appointment. So musculoskeletal health for me is something that's so important as part of this multimodal treatment plan and this team of professionals that we're going to build around these senior pets, because they very often need more than just one modality of treatment or just one medicine. And they need regular assessments as well. So it's not a case of saying, here's your meds and there's your exercise plan, we'll see you back in 6 months. With these dogs with this compromise, we need to be connecting with the owners more frequently and getting that feedback and making those adjustments to medication from the vet point of view, or sort of the physiotherapy type, the therapies, the hydrotherapies, all of these options that are available. And some are more relevant than others at different times in that animal's journey. So some dogs might not be ready for hydro at the beginning, but when you free them up a bit, then they're great on the treadmill or in the pool as well. Or when you free them up, they can then have acupuncture, and that elicits a different response. So I think it's being flexible, but being really observant with your patients and just being prepared to bounce back off other professionals at any point.
Yeah, I totally agree. And the one thing I just wanted to add about myotherapy, which I think is probably most useful out of many of the therapies we've got available, is that with arthritis, we have lots of therapists that are very useful, but not every dog has arthritis. Unfortunately, a very high percentage have arthritis, but not every elderly dog has arthritis. However, I would argue most elderly dogs will have a trigger point here or there. They will have some muscle pain here or there. So I think pretty much all senior dogs could benefit, even if it was just once a year, once every 6 months, from a qualified myotherapist to give them a treatment. But it will solve those longer term issues, and it might actually make the dog walk better, which may make the joint work better, which may prevent arthritis. I mean, there's no way to prove that, but
absolutely. And by keeping a dog in good, or cat in good musculoskeletal health, you're promoting that mobility. And while ever an animal's mobile, joints are moving through that normal range of movement, the muscles are being activated. You're not getting atrophy. You're not losing muscle. because that's really hard to get muscle back when you've lost it. It's much easier to stop that muscle loss in the beginning, you know, and keep that animal mobile as long as possible in sort of you know, an appropriate way, doing an appropriate exercise. And I would argue actually that you know, myotherapy is also really beneficial at the other end of the spectrum for young animals as well. So whilst those growth plates are developing, whilst they're still growing and the body's changing, having that musculoskeletal balance checked on a regular basis is also really beneficial for them.
Yeah, absolutely. Kirsty, to wrap everything up, would you be able to give me your top tips for managing doggies with arthritis?
Oh, my first one, and I think when I was on a live before with Hannah, and it has to be weight control. And I know we all go, oh no, not again. But actually, that's something that again needs to start at puppyhood. We need to talk to owners, we need to educate owners, and we need to explain the relevance of maintaining a good body condition score throughout the animal's life.
Yeah, definitely.
Boring, I'm sorry, but it's so relevant and it's so important.
I think it's so true. My one to add to that then would be that I think exercise, but moderately, is really important. So you've talked about it already in terms of sensible exercise from day one. Making sure you're not overwalking puppies, making sure that you're being mindful of senior pets. If they're dragging behind you on a walk, maybe you've gone a bit too far, maybe you've gone on for a bit too long, maybe you're going too fast. So doing sensible, short, regular exercises on nice, even surface ground that's the dog's going to cope with. That's the best way. If your dog's already got arthritis, that is the best way to help keeping mobile. And for as long as you possibly can, try and do some kind of exercise with them, even if it's 5 minutes sniffari outside and they have a sniff around and smell the plants, something to keep them active.
Actually, and that leads perfectly onto my next one, which is mental stimulation, enrichment. You know, if your dog, and again, I always say cat, because cats, you know, that they get arthritis as well, and actually a really high percentage get arthritis that are never diagnosed. So, you know, with your pet, enrichment, keep that brain active, keep them moving. And actually, you know, it's not natural to stand over a dog bowl to feed in a static position. It's not natural for a dog at all. Why not, if you've got a dog that's a little bit stiff and sore, is reluctant to exercise, why not use a snuffle mat on a raised surface? Don't get them bending down to the ground, just raise it up slightly. Get them snuffling. By engaging their senses, not only are you distracting from the pain that they may be in or the discomfort, you are gently mobilizing them. You're doing so many things in one hit by just not feeding out of a conventional dog bowl.
Yeah, that's such a good tip. I'm going to go first. This is number 4. I'm slowly counting on my fingers so we don't get I'm going to go for mats for slippery flooring or any areas that you think that. So ideally dogs shouldn't really be doing stairs because they can be a nightmare, but if your dog has to do the stairs, make sure there's a nice mat at the bottom so they're not rubbing down them and doing them in a controlled way. If your dog's slippering around while you're trying to feed it, that's where a mat needs to go. If there's an area in the hall that they skid around the corner, that's where another mat needs to go. They aren't always the most beautiful things, having rugs everywhere in your house, and it can be a pain to clean, but honestly the benefit for your dog is going to be huge. And I personally find runners the easiest thing to manage, so you don't have to have it everywhere.
When I had my old boy, my whole house was full of runners, and it meant that he could safely navigate around the house, and I didn't have to constantly watch him for risk of him slipping on the tiles or causing an injury or going down and not being able to get up. The runners absolutely gave him actually a level of freedom that without them he wouldn't have had.
Yeah, brilliant. Have you got another one? Number 5?
Dog ramps for cars. Yeah. Whenever I'm out and I see a dog jumping in or out of a car, I'm like, no, let's not do that. Let's try not to. And it comes back to my, you know, puppyhood, get a dog used to a ramp when they're a puppy so they're not frightened of it, so they know how to use it. But there's so much torsional force goes through those joints when they jump down from a car. I mean, there's various studies. I think, you know, they've kind of settled on between 4 to 10 times the dog's body weight. you've got a 40-kilogram dog, that's massive amount of force going through those joints. If those joints are weakened, inflamed, or arthritic, ouch, that's going to hurt, and it's going to cause more inflammation. So ramps to get in and out of a car, start when they're young, get them used to it, and then when they actually do need it, it's not a problem. You're not having to try and teach literally an old dog new trick.
Yeah,
they know how to do it, they're comfortable doing it, and it will save you so much hassle when they get older if they're used to doing it when they're young.
Yeah, absolutely. My number 6 is going to be kind of going back to when we were talking about anticipatory grief, but if you don't know already, we have an amazing support group called Holly's Army, and it's on Facebook. Just search Holly's Army. It's a really, really friendly community. We have lots of people who are on there as moderators, and we go through and we'll answer your questions. It's open to everybody, so everybody can join in. Anyone who's got a dog who's going through arthritis can join in and discuss different topics and different issues and support each other. And it's a really lovely, welcoming community. So we also are quite strict on giving the best advice we can. So we give you, it's one of the reasons we do these lives, because we think of topics that have kept coming up on Holly's Army, and we'll say, well, let's find an expert to come and talk to us about that, because we haven't got one on that. And yeah, it's a great place to go. So if you aren't already, please join Holly's Army.
No, totally. It's incredibly supportive, and I'm on it every day. Yeah. I'm always looking at things. It's great, isn't it? It's absolutely great. It's a breath of fresh air, I think, for owners, and it's the place to be. And I think linking on from that, try, if you have concerns about your pet, if you notice something, even a really subtle change in your dog, please be proactive, not reactive. Yeah. So don't wait till it gets to the point where you have to go to the vet. If you notice something, please get in touch with your vet or your nurse team as soon as you can. These little things can be indicators, and if we pick them up early, we can stop other things developing with them or intervene at a stage where we can make a real difference. So, and I think that obviously, you know, goes for everything in the health side of things, whether it's, you know, mobility related or medical, but really with mobility, being proactive, not reactive, is the best way to be.
Yeah, you're totally right. I think my one would be for people who have got very arthritic dogs. Well, to be honest, for any dog, enrichment games are brilliant. You can buy, there's so many out there on the market, and there's also doing really cheap things at home, like getting a cardboard box and screwing up some paper and hiding some treats in there. And there's so many ideas. I've seen some great stuff on YouTube. I end up getting lost on all the videos of all these games that people are playing with their dogs, but there's some really good stuff out there. So I would highly recommend it to keep your dog's brain ticking over and keeping them entertained and releasing all those lovely endorphins, which are a natural pain relief as well.
They're amazing. Yeah, absolutely amazing.
Yeah.
Where are we? One more, I think, haven't we?
Yeah, that's it. One more.
Yeah. So I think my biggest thing with a senior dog, a physically compromised dog, let them be a dog. They have to be a dog. Don't take that away from them. Their quality of life, they need to do the things that make them a dog. And that can be achievable even if they're arthritic or uncomfortable. There are things that we can do to help. There are things you can do at home to allow them still to be a dog. A dog needs to stop and sniff on a walk. It needs to get out of its home environment. It doesn't need lots and lots of exercise. So you might drive your dog down to the park and it might have 10 or 15 minutes of meandering through the grasses and sniffing at lampposts and things. That's amazing. That is all that dog needs. But to your dog, mentally as well as physically, that's incredibly important. So we can't wrap our dogs up in cotton wool. You know, when you get a diagnosis of your dog and it's all very overwhelming, and you know, we immediately as humans assume the worst, and then we work our way back to a sense of reality from there by talking to people, decompressing our thoughts and sharing, which is where Holly's Army is incredible for giving sort of reasoned approaches to things and just calming those immediate responses down. Let's let our dogs be dogs, but let's let them do it in a safe, controlled and appropriate way so that they can still enjoy their life. They have a good quality of life. They, you know, we're not stopping them doing the things that they really enjoy. We're just allowing them to do them in a slightly different way.
Absolutely, that's such a great point. And I'm going to end our tips on use your vet nurses because they're fantastic and very knowledgeable and super, super supportive, and often more approachable than us as vets can be, purely because they have the time and they're often better with people. I can say that because I'm a vet, I'm allowed.
You can say that. I wouldn't say that.
Also, if you think your dog is sore, then see if there's a local myotherapist such as Kirsty nearby, because it really could be so beneficial for you. So that would be my tip from tonight. It always makes me so jealous when I see these dogs having these lovely massages. I always think I want to have that because they always look so comfortable afterwards.
They do, and when they snooze and start to snore, it's like,
oh, so lovely.
I know. Yeah. Great.
Kirsty, thank you so much for joining us tonight. It's been brilliant. Hopefully everybody's learned a lot. We've tried to cover from the nursing point of view for vet nurses who want to get more involved in nurse clinics, from the owner point of view, how you can utilise your vet nurses brilliantly, and also from myotherapy point of view as well. So hopefully we've covered a lot of topics, and thank you again for joining us tonight.
No, it's been a pleasure. If anyone's got any questions for any of the CAM team, just send them in to us, and we're always more than happy to try and answer them for you. And if we don't know the answer, we can't answer it, we will find someone that can.
Absolutely. Thank you, everybody, and good night.